Kim here, and you are tuned in to Kim E, the Diabetes MP. Now, currently, when I am filming this is April 2020, and if you're watching this in real time, you know that we're currently going through a global pandemic, a global health crisis. And if you are watching this in the future, months later or years later, you could just Google 2020 pandemic and you'll figure out what is going on currently. Now, I am a family nurse practitioner, and of course, being medical professionals, I feel like it's our duty to stay abreast on what is going on, not just in our own set of patients, but in our cities, in our communities, and nationally and globally. Our patients will have questions. Our patients will need to be educated. So it is our duty to educate ourselves so that we can be a resource for those that we treat and we see. So in light of the coronavirus, the COVID-19 that we're currently experiencing right now, I wanted to pivot my content just a little bit. Now, don't worry, I'm still going to be making content that is related to diabetes education and management. I will continue to do that, but I want to expand the things that I discuss, the content that I discuss. And so since we're all practicing social distancing right now, we're sheltering in, and I'm working from home, I have a little bit more time on my hands. And so I wanted to kind of ramp up a little bit the content that I put out and make it more relevant to what we're experiencing. Now, this video today, I am going to be giving just an educational update for nurses and nurse practitioners related to the COVID-19 virus, just so we are educated and that you will have resources that can help you as you go and come in your practice and you're educating your patients. The next video after this is going to be related to the quarantine and being nurses that quarantine, but after that, my focus is going to really be focused on the new grad nurse, the new grad nurse practitioner. And the reason why I want to focus on the new grad nurse is because this is around graduation time. This is around the time where school is ending, and all of the schools have halted their curriculum, their in-person curriculum, and people are going online. We're in unprecedented times and people are pivoting. And so I want to pivot with my content as well. I want to make sure that I put resources out there, and I am a resource, so that as we're navigating during this time, it will at least give some assistance, you know. One thing is, when I graduated, there wasn't a pandemic. I was able to interview in person. I was able to talk to my professors in person. I was able to complete my clinicals in person. And my heart goes out to those who are in school. And I want to create things that are a resource for you all, so at least this time won't be as hard as it currently is. So all of that intro just to say, and I felt like it was necessary because I want my audience to understand where I'm coming from, what my desire is. I just want to be a resource, and I feel like sitting here making just content over diabetes when I am a family nurse practitioner, I have had experience in other areas of nursing. I have been a registered nurse for over 11 years, a nurse practitioner for 8. To say that I have experience in other things is an understatement. I just don't know diabetes. And so right now I want to really stretch myself as a nurse practitioner educator, and I want to give more resources. So today we're going to be talking about the coronavirus, resources that nurses should know and nurse practitioners should know, the things that you should key in on to help you to help your patients. Okay, so let's talk resources. Okay, now as nurses, at this point, we should know that we should be getting our information from credible resources. Our sources should be reliable and they should be factual, okay? Now, during this time, there are a few organizations that have sent out guidelines as to how to self quarantine, how to self quarantine, how to shelter in. There's a lot of governing bodies that are sending out guidelines for us to follow. And really at this time, when something like this happens, these are the resources that you need to be keying in on and making sure that you're staying up to date on them, okay? And just to let you know, everything that I'm going to be saying today came from these resources and only these resources, okay? Now, I am getting all of my information from the CDC, the World Health Organization, the FDA, as well as the different government briefings, breaking news from my state and my city, as well as globally from President Trump. Typically at this time, he's pretty much getting on every day and doing a briefing, a White House briefing. And so I am staying up on all of those, particularly because, for one, I want to know how to protect myself and my family, and how to also be able to educate my friends and my family, but also to be able, when I get the opportunity to talk on the phone and do virtual visits with my patients, to be able to tell them as well what to do, what's the proper protocol, as well as be able to divert them over to those websites so if they have any questions, they're able to look this up as well. It's very important also, I do want to say this too, it's very important also to also lean into your government officials at this time, because at this time, every state is different. There are different states such as New York and California that have a little bit more stricter restrictions, whereas, and also as well as different cities. Some cities are not as affected as others. So you want to make sure that you're leaning into what your governor is saying, also what your mayor is saying as well, and following those guidelines as well. Another thing, there's a lot of stimulus bills that are coming down the pipe, a lot of relief that is coming for Americans. And so you want to also make sure that you not only understand this for yourself, but you also understand this when it relates to our patients. CMS, which is Medicare and Medicaid, they have come out with a lot of addendums, new articles, lots of guidelines and lots of plans to offset how this is going to affect those who have Medicare and Medicaid, and also how this is going to affect our economy. So you want to make sure that you're leaning into this. And I say this knowing that it's a lot, guys. Like, I am literally, for myself personally, I am looking at it to get my information and to be knowledgeable, but then at a certain point in time, I'm turning it off. It is all day, every day, and I have to protect my peace because I am still a mother, I am still a wife, and I'm still a nurse. And in my lifetime, I have never experienced this in my lifetime. I really don't even think that my parents in their life, in their generation, they experienced a pandemic like this where we're all in the house globally. But we have to make sure that we're protecting our mind and our mindset, we're protecting our heart and our emotions, so we'll be able to get through this and get to the other side. Okay, so what do we need to know? Now, I have some notes here, so if you see me looking down, it's because I want to make sure that I'm giving the right information that I got off of these resources and websites. Also, in my description box, I am going to link every website that I went to, and at least the lead website. And so when you get to the website, you'll be able to go around and browse yourself. But I came across really good information for healthcare professionals, as in how to educate. I want to say one of the websites even had printables that you could send to your patients electronically or leave at the front desk or outside for your patients, however you want to do that, for no contact. And so I want to make sure that I hit these high points. I am not covering everything because it's constantly changing. Every day something new is coming out. So currently I am filming this on April 1st. So anything up to April 1st, it should be up to date up to April 1st. But again, that is why I am going to link the websites, because like I said, things are coming out every day. So yeah, so anywho, let's get into it. I'm not going to say everything. I'm going to hit the high points, and then I urge you to go do your own education. This is your research. This is your beginning. I'm starting it so you can finish it, okay? So with the coronavirus, we've heard that many of the illnesses are mild, but it can be severe, which we know it also can lead to death. Okay, when it first came out, they were saying that we were seeing it primarily in the older population, which is actually the population that I regularly see, the retired and elderly population. They were saying 60 and older, and you had to have underlying conditions. But at this point, there are people who are in their 20s, there are people who are in their 30s. There have even been some children that have been diagnosed with COVID-19, and there have been people who have been put on ventilators, even have passed away, who were not 60 and older and had underlying conditions. At this point, it has touched every area of our life. It has touched every race. It has touched both genders. It has touched it has touched all of our countries, and it has no bearings on socioeconomic. At this time, we have had royals, celebrities, government officials, as well as the common man like me and you, to be affected by the coronavirus. So the coronavirus actually has been here. The family of the coronaviruses have been here for a while, okay? As a large family of viruses, it's actually the COVID-19 is actually a part of the family that includes SARS and MERS, which MERS is the Middle Eastern Respiratory Syndrome, and SARS is the severe acute respiratory syndrome. I didn't write it down all the way out, but I will flash it here if I said it incorrectly. So please give me grace. But typically, many of the coronaviruses you see them in animals and humans, and a lot of times the way that we get a coronavirus is that it comes from an animal, and it has been spread into a human somehow or way. Now, what we're currently seeing right now, what they think where ground zero was, is that it came from Wuhan, China, and in December 2019, and they believe that's where the first case started. And in China, they have been dealing with this for a while, and now they had strict guidelines as to how to go and come. A lot of them, actually all of them at one point in time, all of them had to stay in the house. That was mandatory. And now currently I believe they are able to go out and be able to be out in the public now. So we're at the beginning, they're at the end of their curve, okay? So the symptoms that you're going to typically see, they may appear anywhere between 2 to 14 days after exposure. Now, again, there have been people who have not felt any symptoms. The reason why they knew that they had coronavirus or they were exposed is because, or why they needed to get testing, is because someone that they were around tested positive for coronavirus, and then they got tested because they were exposed to it. And that's how it came up to them being positive for coronavirus. Your symptoms, the main symptoms that you're going to see, you're going to have fever, cough, and this is going to be like a dry, deep cough. It's not going to be a produced, like you're not going to produce anything with this cough. A cough is a dry cough. You're going to experience shortness of breath because this is a virus that affects the respiratory system. And then you're going to also experience fatigue. Now, currently, we do not have a treatment for this. We do not have a vaccine for this. This is new. And so the hopeful thing about this is that we are globally working on coming up with a vaccine, coming up with a treatment, coming up with a way to what they are calling now flatten the curve. So basically for treatment at this point, it's really just supportive measures. Tylenol for the fever, hydrate, and rest. Literally rest. Be in the bed and rest. There are some studies that have happened in other areas of the world that have said that ibuprofen is not good to take Tylenol instead. There's been a lot of research that has gone down where people were saying that it has been proven that ibuprofen actually makes it worse. And so again, this is new. And there's a lot of variables that have been out there. So I would say do your research, and it wouldn't hurt just to take Tylenol. We know Tylenol is just as effective, and so it would be good until we know more to just be safe and just take the Tylenol. Now let's talk a little bit about the spread. There's been a lot that has been given to us. There's a lot that we know, and there's a lot that we're still trying to figure out. At this point, the spread is through small droplets, okay? It is not an airborne, it is not transmitted as airborne, and the reason being is because these droplets are so heavy that they won't stay in the air long. So they're recommending, and I actually saw on the World Health Organization site as well as the CDC site, to make sure our social distancing is at least a meter, which is 3 feet. I've also been here in Texas, and I've heard other places as well. Some of these other resources actually say 6 feet. I am being safe, and I am doing 6 feet. The reason being is because these droplets cannot travel that amount, and by the time they get to that distance, they have now dropped on whatever surface, whether it be outside, whether it be as the person is coughing or sneezing. Those droplets from them talking from their mouth, their nasal passage, has come out and it has landed wherever they are, okay? And typically what happens is when a person is infected, they cough, they sneeze, or exhale, those droplets, like I said, land, or even if they just breathe the droplets out, it can land on surfaces. And how people have been typically coming down with the coronavirus is that someone sneezes, the droplets land on a surface, and another person comes through and they touch that surface. They go and they touch their eyes, or they're not washing their hands properly, and they're spreading that virus. It's very elementary and very it's not rocket science as to how this is spreading. It's the same reason why we tell little kids to wash their hands, because you can do this with your nose, do that, and then go touch everything, and now your germs are everywhere. They are still trying to test exactly how long this virus is alive on different surfaces, and it varies, okay? And so again, it's still a novel disease, meaning that it's very new, and so we're still studying it. We're still trying to figure out how this virus moves and it works. And so what they are advising everyone to do is, hey, wash your hands as much as you possibly can. Wash your hands, use soap, and scrub for at least 20 seconds. Something that we tell our children to do, but we have to remind the community of this, as well as if you're sneezing or if you're coughing, cover in the bend of your elbow and cough into your elbow, not into your hand. You can also cough and sneeze into a tissue and then dispose of that tissue as well. So the incubation period, which is basically from the moment that you're exposed to the virus up until you have symptoms, that period there is the incubation period. Typically, they're saying that it's anywhere between 1 to 5 days commonly, and you you typically will see or feel symptoms at day 5, okay, of that period. Okay, so let me run back through the protective measures, the protection measures that we need to be practicing ourselves, as well as telling our patients about as well. First things first, wash your hands, okay? Let's wash our hands very often whenever we touch something, when we go to the bathroom, when we cook, before we cook, after we cook, if we're wiping our noses, because let's keep it all the way real. This is also allergy season, and outside of the coronavirus, this is flu season. And so let's be diligent in washing our hands when we get the opportunity with soap, and having good hand hygiene, using your hand sanitizer that has the appropriate level of alcohol. I've seen 2 different concentrations, 60%, and then I've also seen 70%. Again, do your research because there's a lot going out there, and anything that's new, we need to update ourselves on that as well. Also, social distancing. At this point, I'm in Texas. We are just sheltering in, and we're practicing social distancing. We can go out for essential things. We can go to the supermarket. We can even go to parks. But even with that, making sure that you're at least 3 feet. I am practicing 6 feet because I have heard that from other outlets. So out of the 2, I'm like, you know what? I'm going to do 6 feet between you and others. And avoid touching your eyes, your nose, your mouth. Okay, good respiratory hygiene. When you cough or sneeze, make sure that you're doing that into the bend of your elbow. Dab, for anybody who knows that. And make sure that you're disinfecting your surfaces regularly to make sure that we're killing any of the germs that may possibly be on our surfaces. Because again, they do not know from the different surfaces how long this virus can last, okay? From it being wood, from it being marble, from it being carpet, they don't know, okay? And so make sure that you're disinfecting your surfaces regularly. Also, here are some emergency warning signs that you should know, as well as your patients. First off, if you're having trouble breathing, if you're having persistent pain or pressure in your chest, bluish lips or face, or you're having the inability to arouse and new confusion. Now, me just saying that right there, that lets me know that's hypoxia. This is a respiratory disease, and when you see things like that, those are warning signs. That would be warning signs for practically anything, but definitely in this situation, this is when you would seek emergency help. And they are asking everyone that if you're not severely ill, stay out of the hospital, stay out of the ER. They are running out of supplies, ventilators, and you're actually increasing your risk for exposure by being there. So if you shouldn't be there, don't go there. All right, now 2 more things and then I'm going to log off. If a person is sick, you should stay at home. And most are mild cases, so staying at home is going to be perfectly fine for you. Stay away from others, and if you happen to have any medical visits, make sure you call ahead as a common courtesy to let people know that, hey, I may be exposed to coronavirus. I may even be diagnosed with coronavirus, and they may even be able to triage you over the phone, or even may be able to conduct your visit through telephonic or virtual visits. And this is one of the reasons why you want to call ahead, because you don't want to go and then expose people in the waiting room, as well as the healthcare professionals and their staff as well. Now, here is something that I really want to mention and talk about, because this is very important, okay? This is when should you discontinue isolation if you're self-quarantining, if you have been exposed and you're just doing this as a safety measure, or if you've been a confirmed case of coronavirus. This is when you can come out of self-quarantine and go into the back around other people, okay? Now I'm going to read this verbatim because I want to make sure that we understand it. So first off, you need to have no fever for 72 hours. It was sure to say 3 full days, okay? And your other symptoms have improved, and at 7 days, 7 days have passed since your symptoms first appeared. And this is if you have not had a confirmed test and you have been exposed and you have the symptoms and you want to just self-quarantine. This is what you're going to do. Again, no fever for 3 full days. Your other symptoms have improved and you are 7 days past since your first symptom appeared, okay? Now, if you are a confirmed case, you would need to be fever-free for a full 3 days, okay? Your other symptoms have improved and you have 2 negative tests in a row. They need to be 24 hours apart. And of course, your doctor will be following the CDC guidelines, but those are the 2 differences when you can DC isolation, okay? Whew, that was a lot. Okay, guys, I know this is pretty much a longer video than I typically do, but I thought that it was definitely necessary for me to do this. Again, this video is going to be covering the COVID-19 as well as the next video is going to be related to it. And then after that, I'm going to be focusing heavily on resources and things for the new grad nurse. And even some of these things would be things that, you know, to be quite honest, probably even seasoned nurses could probably use it as well. I just want to be a resource. That has always been my desire. That's what I'm trying to do, and that's what I will continue to do. I want to urge everybody, be safe, guys. Be safe. My thoughts, my prayers are with those who are working the front lines, our colleagues that are working so diligently. I am praying for you. I'm thinking about you every single day, and we appreciate everything that you are doing. I wanted to make sure that I say that because I remember working the bedside. It's been years since I worked the bedside, but I cannot imagine what you all are going through, and my heart is open towards you guys right now. If you have not already, go ahead and subscribe and ding that notification bell. And I would love for you to follow me over on Instagram at @TheDiabetesNP. I do want to leave us with something right now, which is very important in light of everything that's going on. It's important outside of a pandemic, but it's very important now. I want to remind us of this. Let us never leave a nurse behind. You guys stay safe. Bye-bye.